Peace be upon you and God's mercy and blessings. Welcome everyone. Thank you for joining us today for another meeting. Today we're also talking about diabetes. There's a question we as diabetes doctors are often asked or ask ourselves, Doctor, do I have insulin resistance or not? In reality, diabetic patients come in and we are surprised to find that they are already diagnosed with diabetes and are taking medication for it. And in fact, we have already done an HbA1c test for them before and everything is fine and we are following up with them. But then we are surprised when they tell me or ask me in the clinic, Doctor, I want to make sure, do I have insulin resistance or not? Can you do an insulin resistance test for me? So does every diabetic patient, everyone have insulin resistance? And is it possible, for example, that there is a diabetic patient who doesn't have insulin resistance, so we need to test them for it? And honestly, this is a question that many people might not be aware of. Of course, every patient with type 2 diabetes has insulin resistance. In fact, it's the insulin resistance that caused their diabetes in the first place. But for type 1 diabetes patients, theoretically or scientifically, they don't have insulin resistance. However, if you look at it in a broader sense, you'll find that they also have insulin resistance. So what does all this mean? First, we need to understand what insulin resistance actually is. We've mentioned before in previous videos that insulin resistance means the insulin being produced is simply not enough for your body, to put it plainly. And the reason it's not enough is either because the amount is low, almost non-existent, or completely absent. Or it could be that the receptors, the insulin receptors, which are supposed to allow insulin to work, are too few in number or something like that. So in order to overcome insulin resistance, the body is forced to secrete more insulin to try to get past that resistance and make the most use of the available receptors as much as possible. Of course, this is the case for someone with type 2 diabetes. Insulin resistance is what happens first. A person develops insulin resistance, then the issue gets worse and worse, leading to resistance to sugar, and then it continues to worsen until it eventually becomes diabetes. Therefore, any patient with type 2 diabetes definitely has insulin resistance. There's no need for them to do an insulin resistance test. They definitely have insulin resistance, period. In fact, we've already passed that stage and entered into diabetes. But the reality is different for type 1 diabetes patients. We said that its causes are either genetic, right? And in the end, they are usually immune-related causes. They have antibodies that unfortunately attack the pancreas and the cells that produce insulin, destroying them so they don't have insulin to begin with. Or God forbid, they were exposed to an illness that affected the pancreas. Exactly. Sometimes the pituitary gland and similar issues can affect the pancreas, leading to fibrosis, destroying the pancreas and damaging the cells that produce insulin.